Porn addiction is considered a type of behavioral addiction, akin to gambling or internet addiction. It involves compulsive consumption of pornography, often despite negative consequences to one's mental health, physical well-being, social life, or career. Like substance addictions, pornography addiction can activate the brain's reward system, creating a cycle of dependency that becomes increasingly difficult to break. What happens inside the brain of porn addicts? The human brain is wired to seek out pleasure and avoid pain. When we engage in pleasurable activities, such as eating or having sex, our brains release dopamine, a neurotransmitter that creates feelings of happiness and satisfaction. However, repeated exposure to certain stimuli, like pornography, can hijack this natural reward system. Repeated exposure to porn lead to: Number 1. Overstimulation of dopamine pathways. Just like with drugs or alcohol, frequent consumption of pornography can lead to overstimulation of dopamine pathways in the brain. Over time, this overstimulation can cause the brain to become less sensitive to dopamine, requiring more and more of the same stimulus to achieve the same level of pleasure or satisfaction. This is known as tolerance, a hallmark of addiction. Number 2. Desensitization. As the brain becomes less responsive to dopamine, porn addicts may feel less pleasure from everyday activities. This desensitization can lead them to seek out increasingly extreme or novel forms of pornography to regain the original sense of arousal or excitement. Number 3. Reduced gray matter in the prefrontal cortex. Some studies have shown that individuals who report high levels of pornography consumption have reduced gray matter in their prefrontal cortex, the part of the brain responsible for decision-making, impulse control, and social behavior. This reduction can impair a person's ability to exercise self-control and make healthy choices, further reinforcing addictive behaviors. Number 4. Impaired neural connectivity. Chronic porn consumption can weaken neural connections between different regions of the brain, such as the prefrontal cortex and the reward center, nucleus accumbens. This can lead to impaired decision-making abilities and reduced capacity to resist urges or delay gratification. Porn addiction can lead to a host of psychological and emotional challenges, often compounding the difficulties an individual might face. Negative self-perception. Many individuals addicted to pornography report feelings of guilt, shame, or self-loathing. These emotions can create a vicious cycle where negative feelings lead to more pornography consumption as a way to cope, which in turn exacerbates the feelings of guilt and shame. Increased risk of depression. Studies suggest a correlation between high levels of pornography use and symptoms of depression. This may be due to a combination of factors, including disrupted sleep patterns, social isolation, and the aforementioned negative self-perception. Anxiety and social phobia. For some, porn addiction can fuel social anxiety and lead to withdrawal from real-life interactions. The addict may fear judgment or feel inadequate in social or sexual situations, choosing instead to retreat into a virtual world that offers a controlled environment free of real-life consequences. Porn-induced erectile dysfunction. One of the most talked about psychological effects of pornography addiction is porn-induced erectile dysfunction. This condition occurs when individuals who consume large amounts of pornography find it difficult to become aroused or maintain an erection during real-life sexual encounters. The brain becomes so accustomed to the highly stimulating nature of pornographic content that it has difficulty responding to less intense, real-world stimuli. Reduced interest in real-life partners. Over time, individuals addicted to pornography may find themselves less interested in their real-life partners, leading to reduced intimacy and sexual satisfaction in relationships. This can create tension and conflict, further damaging the relationship. Pornography addiction doesn't just affect the individual, it can also have profound consequences for their relationships, such as emotional disconnection. For many addicts, pornography becomes a substitute for real emotional connection. This can lead to emotional distance in relationships, as the addict may become less interested in nurturing the emotional and physical intimacy that is essential for healthy, fulfilling partnerships. Trust issues and betrayal. Partners of porn addicts often feel betrayed, especially if the addict has been hiding their behavior. This can lead to feelings of mistrust, anger, and resentment, which may take years to repair or may result in the end of the relationship altogether. Distorted perceptions of sex and relationships. Regular exposure to pornography can lead to unrealistic expectations about sex, appearance, and behavior. Pornography often portrays an idealized, often exaggerated version of sex, which can create unrealistic standards that are impossible to meet in real-life situations. Increased relationship conflicts. These distorted perceptions and unrealistic expectations can contribute to increased conflicts between partners. When one partner feels that their real-life relationship cannot measure up to the fantasies portrayed in pornography, they may feel dissatisfied, leading to arguments and a potential breakdown in communication. What porn addicts may experience day to day. As addiction progresses, individuals may exhibit a variety of behavioral changes that can have significant impacts on their daily lives. Number 1. Loss of productivity. Neglect of responsibilities. Many porn addicts find themselves neglecting responsibilities at work, school, or home in favor of consuming pornography. This can lead to decreased productivity, poor performance, and in some cases, job loss or academic failure. Procrastination. Addicts often use pornography as a means of procrastination, choosing it over more important tasks. This can lead to a backlog of responsibilities and increased stress, which may, in turn, drive further consumption as a coping mechanism. Number 2. Risky or impulsive behaviors. Escalation to risky behaviors. Some addicts may engage in risky or impulsive behaviors to seek out more intense forms of stimulation, such as attempting to meet people online, seeking out sex workers, or engaging in risky sexual behaviors. These actions can have legal, social, and health consequences, including the risk of sexually transmitted infections, STIs. Compulsive consumption in inappropriate settings. Some individuals may find themselves consuming pornography in inappropriate settings, such as at work, school, or in public places, driven by the compulsion to engage in the behavior despite the potential for severe consequences. Number 3. Sleep disturbances and fatigue. Disrupted sleep patterns. Many addicts report staying up late into the night consuming pornography, leading to disrupted sleep patterns. Chronic sleep deprivation can have numerous negative effects on physical and mental health, including weakened immune function, impaired cognitive performance, and increased risk of depression and anxiety. Chronic fatigue. The combination of sleep deprivation, poor nutrition, and lack of physical exercise associated with addiction can lead to chronic fatigue, reducing the individual's ability to function effectively during the day. Number 4. Physical health issues related to sedentary behavior. Sedentary lifestyle. Excessive pornography consumption is often associated with a sedentary lifestyle, which can contribute to a range of health issues, including obesity, cardiovascular disease, and metabolic disorders. Repetitive strain injuries. While less common, some individuals may develop repetitive strain injuries, such as carpal tunnel syndrome, from prolonged use of electronic devices. Porn addiction is a complex issue with far-reaching consequences that go beyond mere consumption. It affects the brain's structure and function, leading to changes in dopamine pathways and impaired decision-making abilities. Psychologically, it can contribute to depression, anxiety, reduced sexual satisfaction, and the compulsion to seek out more extreme content. Socially, it can damage relationships, create emotional distance, and foster unrealistic expectations about intimacy and sex. Behaviorally, it may result in risky actions, loss of productivity, and even legal trouble. Physically, it can disrupt sleep patterns, contribute to a sedentary lifestyle, and cause other health issues. Thanks for tuning in. If you found this video insightful, don't forget to give it a thumbs up and subscribe for more deep dives into topics that matter. Remember, if you or someone you know is struggling with porn addiction, know that you're not alone. There are resources and support available to help you navigate this journey. Drop a comment below with your thoughts or any questions you might have. I'd love to hear from you.